I'm Dr. Angie Bexley from the Crawford School of Public Policy at the Australian National University. Inclusive policy and programming responses require accurate data on who is left behind and in what ways to enable governments to respond appropriately and effectively. The Individual Deprivation Measure, or the IDM, provides a measurement of multidimensional poverty at the individual level. It provides disaggregated data on how social groups experience poverty. These data are particularly urgent for bridging the current data gap for women and men with disability. In 2018, the Australian National University, working with an Indonesian firm, SurveyMeter, undertook an IDM study in South Sulawesi in Indonesia. We surveyed over 5,600 women and men over the age of 16 years. Here, I want to share with you some key results from Jenna Ponto. Using the Washington Group short set questions to identify people with disability, 306 people were included in the survey, 234 women with disability and 72 men with disability. And although these are relatively small numbers of people with disability, some important patterns start to emerge and complement what we already know about people with disability. Let's take a look at some of the data that reveals the multidimensional nature of poverty for women and men with disability. Overall, it is clear from the data across all aspects of deprivation, women and men with disability are more deprived than people without disability. From the data on food, people with disability experience deprivation more deeply, and women with disability were more deprived when it came to both quantity and quality of food. From the data on water, a similar story was revealed, with men and women with disability being more deprived across all variables compared to those without disability. The data on water also revealed gender differences. While men with disability were more likely to report having inadequate treatment for drinking water, it was women who bore the disproportionate responsibility for collecting water and reported experiencing threats while doing so. In terms of healthcare, women and men with disability were more likely to access healthcare, but to also have more problems while doing so. The quality of healthcare matters and is unequal between these groups. A total of 10% of women with disability and 3% of men with disability reported that they were not treated with respect while accessing healthcare. People with disability also experience more mental health issues. Around 30% of people with disability experienced worry, nervousness and anxiety on a daily level. This was compared to 14% of people without disability. This was disproportionately felt by women with disability. Another issue pertaining to women is menstruation. It is clear from the data that women with disability experienced more menstruation poverty than women without disability. They were more than twice as likely to report not using any sanitary products during their last menstrual period than women without disability. Women with disability were also more likely to experience stigma because of menstruation. Men with disability reported more deprivation compared to women with disability on a number of indicators relating to sanitation, relationships and clothing. For example, more men with disability than women with disability had no access to toilet facilities or a place to wash their hands. When it comes to work, both women and men with disability work long hours and experience heavy time burdens. In terms of paid work, there was no difference between those with and without disability in terms of the average hours spent in paid work. There is a difference in unpaid work though. People with disability reported more hours than people without disability. When we look at combining paid and unpaid work, there are gender differences. Typically, women with disability reported spending 7.5 hours in unpaid work. This was compared to 5.5 hours worked by that of a typical man with disability. And our analysis shows that people with disability were just as likely as people without disability to have children in their care while undertaking these activities. and women with disability bore this disproportionately. When we consider food, water, menstruation poverty, work and time burdens, we can begin to understand how the gendered nature of deprivation among people living with disability affect women and men in different ways. The results from the IDM country study in Indonesia provide policymakers with the data needed to address poverty and where gender and disability intersect to ensure that nobody is left behind.